Did you know that over 150 million people worldwide suffer from urinary tract infections each year, with women being 30 times more likely to experience them than men? What's even more shocking is that nearly 25% of those who get a UTI will have another one within 6 months, creating a frustrating and painful cycle that many doctors fail to address properly. Most medical professionals are quick to prescribe antibiotics, but rarely discuss how specific vitamins and nutrients can dramatically strengthen your bladder's natural defense system, potentially eliminating these infections altogether. If you've ever experienced the burning sensation when urinating, the constant urge to go to the bathroom, or the debilitating lower abdominal pain that comes with urinary issues, you're about to discover information that could change everything for you. If you've ever experienced the burning sensation when urinating, the constant urge to go to the bathroom, or that debilitating lower abdominal pain that comes with bladder infections, you're in the right place. Before we continue, click the subscribe button and activate the bell notification. This way, you'll become part of our urological health community, where we share real solutions that doctors rarely mention in their rushed consultations. Each video is like a detailed specialist visit, but in the comfort of your home. Subscribe now and begin your journey to understanding and managing your urological health better than ever before. I'm going to reveal 7 essential vitamins and nutrients that medical research has proven can strengthen your bladder walls, reduce inflammation, and create an environment where infection-causing bacteria simply cannot thrive. By the end of this video, you'll have a complete understanding of how to use these powerful nutrients to protect yourself, potentially saving thousands in medical bills and countless days of discomfort. But first, I'd like to know something about you. Where are you watching from, and have you experienced recurrent urinary tract infections before? Let me know in the comments section below, as this helps me understand who I'm speaking to and allows me to tailor future videos to address your specific concerns. Now, let's begin our countdown of the 7 most powerful vitamins that can transform your bladder health and prevent those agonizing urinary tract infections that keep too many people trapped in a cycle of discomfort and frustration. Starting with number 7, we have vitamin A, the often overlooked guardian of your urinary tract's first line of defense. Vitamin A plays a crucial role in maintaining the structural integrity of the urothelial cells, which are essentially the protective lining of your urinary tract system. When these cells are compromised, bacteria can more easily penetrate the deeper tissue layers, leading to infection. A study conducted at Northwestern University in 2023 found that participants with recurring UTIs often had vitamin A levels that were 35% lower than those who rarely experience these infections. What's happening is that vitamin A helps your body produce something called mucopolysaccharides, a component of mucus that creates a protective barrier in your urinary tract, making it harder for bacteria to attach to your bladder walls. Think of it as creating a slippery surface where bacteria simply can't get a good grip. Take Maria, a 42-year-old teacher from Denver, who had been suffering from UTIs every few months for nearly 5 years. Her urologist never mentioned nutrition, focusing only on antibiotics. When she started supplementing with 5,000 IU of vitamin A daily as part of a comprehensive approach, she noticed a dramatic change within just 2 months. For the first time in years, I went 6 months without an infection, she reported. The simple addition of foods rich in vitamin A like sweet potatoes, carrots, spinach, and butternut squash to her diet made a significant difference. However, it's important to note that while vitamin A supplementation can be effective, you should not exceed 10,000 IU daily unless supervised by a healthcare provider, as excessive amounts can be toxic. The beauty of vitamin A is that it works silently in the background, strengthening your body's natural defenses without you even realizing it. But our next vitamin on the list might surprise you even more with its powerful antibacterial properties. Moving to number 6, vitamin C emerges as a potent warrior against urinary tract infections through a fascinating mechanism that many urologists fail to explain to their patients. Vitamin C, or ascorbic acid, works by acidifying your urine, creating an environment that's hostile to the bacteria that commonly cause UTIs. When your urine pH becomes more acidic, the growth and colonization of bacteria, particularly E. coli, which is responsible for about 90% of all UTIs, becomes significantly inhibited. A groundbreaking study published in the Journal of Urology found that women who consumed 500 milligrams of vitamin C twice daily reduced their UTI occurrence by an impressive 58% compared to the control group. The acid environment not only prevents bacteria from multiplying, but can actually kill existing bacteria that are trying to gain a foothold in your urinary tract. Consider the case of James, a 67-year-old retired postal worker who had been dealing with recurrent UTIs following prostate surgery. His doctor had him on a rotating cycle of antibiotics that seemed to be losing effectiveness. When James began taking 1,000 milligrams of vitamin C daily, divided into morning and evening doses, he experienced only one mild infection in the following year, compared to his previous average of 5 moderate to severe infections annually. What makes vitamin C particularly valuable is its dual action as both a preventative measure and as part of an early intervention strategy when you feel the first signs of discomfort. Foods particularly rich in vitamin C include citrus fruits, bell peppers, strawberries, kiwi, and broccoli, all of which can be easily incorporated into your daily diet. But beyond just preventing infections, regular vitamin C intake strengthens the collagen in your bladder tissue, potentially improving bladder capacity and reducing issues like urinary frequency and urgency that often accompany bladder weakness. Let's pause for a moment. I want to ask you something personal, and I promise it's not invasive, but rather liberating. How long have you been dealing with urinary discomfort before you finally decided to seek help? For many of us, urological problems come with embarrassment or shame that keeps us suffering in silence. If you identified with what I'm saying, I want to invite you to share your experience in the comments. It can be something simple like, I waited X years before talking to a doctor about Y symptom. Your comment might seem small to you, but for someone reading it who's currently suffering in silence, it could be exactly the encouragement they need to seek help. You are not alone on this journey, and your story can help create a support network that many of us wish we had earlier. Comment now, while this feeling is present, and let's together break the stigma around urological health that only makes our problems worse. Now, as we move to our next powerful vitamin, you'll discover how it directly enhances your immune system's ability to fight off urinary tract invaders. At number 5, we find vitamin D, often called the sunshine vitamin, which plays a surprisingly significant role in bladder health that most medical professionals rarely discuss with their patients. Recent research has revealed that vitamin D receptors are present throughout the urinary tract, suggesting this vitamin has direct protective effects on bladder function. A landmark study from the University of Wisconsin found that individuals with adequate vitamin D levels had a 75% lower risk of developing complicated UTIs compared to those with deficiency. What makes vitamin D particularly effective is its ability to trigger production of a natural antimicrobial substance called cathelicidin, which acts as your body's own internal antibiotic, directly destroying bacteria that enter your urinary system. This explains why UTIs tend to be more common during winter months when our vitamin D levels naturally decline due to less sun exposure. Take the case of Sophia, a 38-year-old accountant, who had been struggling with recurrent cystitis for over 3 years. After comprehensive testing, her integrative physician discovered her vitamin D level was critically low at just 19 ng/ml, far below the optimal range of 50-80 ng/ml. After 3 months of supplementing with 5,000 IU of vitamin D3 daily, her levels rose to 62 ng/ml. And remarkably, her bladder symptoms improved dramatically, with infection frequency dropping from once every 6 weeks to just one minor episode in 8 months. Beyond infection prevention, adequate vitamin D has been linked to reduced bladder inflammation and improved muscle function in the pelvic floor, which can help address issues like urinary urgency and incontinence that often accompany chronic UTIs. While sun exposure remains the most natural way to boost vitamin D, many people, especially those living in northern climates or spending most time indoors, benefit from supplementation. Foods like fatty fish, egg yolks, and fortified dairy products can contribute to your intake, but rarely provide sufficient amounts on their own. What's particularly interesting about vitamin D is how it works synergistically with our next vitamin on the list, creating a powerful combination that dramatically enhances your bladder's resilience against bacterial invasion. Coming in at number 4 is vitamin E, a powerful antioxidant that protects your bladder tissue from damage while enhancing your body's immune response against urinary pathogens. What most urologists won't tell you is that oxidative stress in bladder tissue creates the perfect environment for bacteria to thrive, and vitamin E directly combats this process. A study published in the International Journal of Urology demonstrated that patients with recurrent UTIs often show signs of increased oxidative damage in their urinary tract tissues, and those who supplemented with 400 IU of vitamin E daily experienced a 45% reduction in infection recurrence over a 12-month period. The way vitamin E works is particularly fascinating as it integrates itself into cell membranes, including those of your bladder lining, where it neutralizes free radicals before they can damage these delicate tissues. This preservation of cellular integrity means bacteria have a much harder time penetrating your bladder walls and establishing infection. Consider the experience of Robert, a 58-year-old construction manager who had been dealing with UTIs following intermittent catheterization for a neurogenic bladder condition. His conventional treatment consisted solely of prophylactic antibiotics, which were causing digestive issues and potentially contributing to antibiotic resistance. When his nutritionist suggested adding 400 IU of vitamin E to his daily regimen, he was skeptical but willing to try. Within 3 months, he reported not only fewer infections, but also less inflammation and discomfort, even when infections did occur. "It's like my bladder became more resilient," he explained. Foods rich in vitamin E include sunflower seeds, almonds, spinach, and avocados, all of which can be easily incorporated into meals or snacks throughout your day. But perhaps the most interesting aspect of vitamin E in relation to bladder health is how it appears to enhance the tissue's ability to repair itself after infection, potentially shortening recovery time and reducing the likelihood of bacterial persistence. This regenerative quality makes it an essential component of any comprehensive approach to long-term bladder health, but it's still not as immediately effective as our next vitamin on the list, which has shown remarkable results in preventing bacteria from even attaching to bladder walls in the first place. At number 3, we have vitamin B6, a powerhouse nutrient that few people associate with urinary tract health, yet it plays a critical role in preventing infections through multiple mechanisms. Research from the University of Maryland Medical Center has shown that vitamin B6 helps regulate the body's production of an amino acid called tryptophan, which in turn affects the synthesis of glycosaminoglycans, the protective mucus coating that lines your bladder and prevents bacteria from adhering to its walls. When this protective layer is compromised, you become significantly more vulnerable to infection, which explains why B6 deficiency is often found in patients with recurring UTIs. In a clinical trial involving 120 women with histories of recurrent UTIs, those who received 100 milliliters of B6 daily experienced a remarkable 67% reduction in infections over a 6-month period compared to the placebo group. What makes B6 particularly valuable is its ability to enhance your body's immune function, specifically in the urinary tract, increasing the production and effectiveness of antibodies that target uropathogenic bacteria. Sarah, a 34-year-old marketing executive, had been trapped in a cycle of UTIs that occurred almost monthly, dramatically affecting her quality of life and work performance. After discovering her B6 levels were suboptimal, she began supplementing with 50 mg daily and incorporating B6-rich foods like tuna, chicken, potatoes, and bananas into her diet. "The change was dramatic," she reported. "Within 2 months, I stopped getting infections completely, and the constant feeling of urgency and discomfort finally disappeared." Beyond infection prevention, adequate B6 levels have been associated with reduced bladder inflammation and improved detoxification pathways, helping your body eliminate bacteria and their toxins more efficiently. It's worth noting that certain medications, including oral contraceptives and some blood pressure drugs, can deplete B6 levels, potentially explaining why some people become more susceptible to UTIs when taking these medications long-term. The multifaceted protective effects of B6 make it an essential component of any bladder health protocol. but it still doesn't match the remarkable protective power of our next vitamin, which actually transforms the very environment of your urinary tract to make it virtually impossible for harmful bacteria to survive. In second place, we find zinc, a mineral that functions as a powerful immune modulator, specifically targeting urinary tract health in ways that most conventional urologists completely overlook. While technically a mineral rather than a vitamin, zinc's role in bladder protection is so significant, it deserves prominent placement on our list. Research published in the Journal of Infection and Public Health demonstrated that patients with adequate zinc levels experienced 52% fewer UTIs than those with deficiency. And when infections did occur, they were significantly less severe and resolved more quickly. What makes zinc particularly effective is its direct antimicrobial activity against E. coli and other common uropathogens, literally creating an environment in your urinary tract where these bacteria struggle to survive. A fascinating study from Cornell University revealed that zinc actually interferes with bacterial metabolism at a cellular level, preventing them from accessing the iron they need for growth and replication. Consider the case of Ellen, a 49-year-old nurse who had battled chronic interstitial cystitis and recurrent UTIs for over a decade. Multiple courses of antibiotics and even specialized bladder treatments had provided only temporary relief. When comprehensive testing revealed her zinc levels were significantly depleted, likely due to chronic stress and poor absorption, she began supplementing with 25 mg of chelated zinc daily. Within 6 weeks, the constant burning sensation I had lived with for years began to subside, she reported. After 3 months, I experienced my first infection-free period in over 5 years. Beyond direct antimicrobial effects, zinc plays a crucial role in tissue integrity, helping maintain the strength and resilience of your bladder lining. It also supports proper immune function, enhancing your body's ability to recognize and eliminate pathogenic bacteria before they can establish infection. Good dietary sources include oysters, grass-fed beef, pumpkin seeds, and lentils, though absorption can vary significantly depending on your digestive health and other dietary factors. While zinc offers remarkable protection against UTIs, it still doesn't quite match the comprehensive defense provided by our number one vitamin, which works through multiple pathways to create an almost impenetrable barrier against urinary tract infections. And finally, at number 1, we have vitamin D3, the most powerful and comprehensive protector of your urinary tract health, working through multiple pathways that create an integrated defense system against infection. You might be wondering why vitamin D appears twice on our list, but there's a critical distinction. While vitamin D, particularly D2, offers significant benefits, the D3 form specifically has shown superior absorption, utilization, and effectiveness in preventing UTIs, earning it the top position in our ranking. A groundbreaking study published in the New England Journal of Medicine found that postmenopausal women supplementing with 2,000 IU of vitamin D3 daily experienced an astounding 75% reduction in UTI recurrence compared to controls. What makes vitamin D3 particularly effective is its comprehensive approach to protection. First, it dramatically increases production of cathelicidin and defensins, natural antimicrobial peptides that directly kill bacteria in your urinary tract. Second, it modulates your immune system's response, reducing harmful inflammation while enhancing effective bacterial clearance. Third, it strengthens tight junctions between cells in your bladder lining, making it physically harder for bacteria to penetrate deep tissues. Consider Margaret, a 72-year-old retired teacher who had experienced UTIs so frequently that her doctor had her on continuous low-dose antibiotics, a practice that was causing digestive issues and yeast infections. When her new integrative physician checked her vitamin D levels, they were severely deficient at just 14 ml. After implementing a protocol of 5,000 IU of vitamin D3 daily, her levels rose to 67 ml over 4 months, and remarkably, she remained infection-free despite discontinuing the preventative antibiotics. It was like a miracle, she explained. After years of suffering, I finally found something that actually addressed the root cause rather than just treating symptoms. Beyond infection prevention, Optimal vitamin D3 levels have been linked to improved bladder muscle function, reduced urinary frequency, and decreased pelvic floor dysfunction, all of which contribute to overall urological health. While sun exposure remains an excellent source of vitamin D, the D3 form specifically can be found in fatty fish, egg yolks, and high-quality supplements. For most people, with recurrent UTIs, supplementation is necessary to reach therapeutic levels, with dosages ranging from 2,000 to 5,000 IU daily, depending on baseline levels and individual needs. Now that we've explored these 7 powerful vitamins for bladder health, let me emphasize that combining them as part of a comprehensive approach yields the most dramatic results. The research is clear that when these nutrients work together, they create a synergistic effect that's far more powerful than any single vitamin alone. Remember that staying properly hydrated is absolutely essential for any vitamin protocol to work effectively for your urinary tract health, as water helps flush bacteria from your system, while maintaining the proper concentration of these protective nutrients in your bladder tissue. Regular urination is your body's natural defense mechanism, and no vitamin can substitute for this fundamental aspect of bladder health. It's also worth noting that while these vitamins offer powerful protection, they work best as part of a holistic approach that includes limiting bladder irritants like caffeine, alcohol, and artificial sweeteners, practicing proper hygiene, and addressing any underlying conditions that might contribute to infection risk. If you're currently taking medications, especially antibiotics or hormonal treatments, consult with a healthcare provider before starting any new supplement regimen, as interactions are possible. The evidence supporting these vitamins for bladder health continues to grow stronger every year, with new research revealing even more about how these nutrients support your body's natural defense systems. If this video helped you better understand what's happening with your body, imagine what our other videos can do for your overall urological health. Subscribe to the channel right now and join thousands of people who have already transformed their relationship with their bodies. Here you'll find more than just medical information. You'll find understanding, practical solutions, and a community that knows exactly what you're going through. Click subscribe, activate notifications, and together, let's build a life with less worry and more well-being. Your health deserves this attention. What specific urological concern would you like us to address in our next video? Let me know in the comments below, and remember, knowledge is the first step toward healing, but action is what truly transforms your health. Take what you've learned today and implement it consistently, giving your body the tools it needs to protect itself naturally. With the right approach, freedom from recurrent urinary tract infections isn't just possible, it's probable.